In the last video, we talked about procedures that Megan Fox has been accused of having. In this video, we're going to discuss the procedures she actually has had done because she admits them. And then she's gatekeeping one, and I think I know what it is. Stay tuned to the end and I will reveal it.
So I'm just going to go through all the things that I've done.
Love.
What I have had done, like I said, I had my boobs done when I was 21 or 22. I had them redone after I was done breastfeeding my kids because I don't know where they went, but they went. And then I had to have them redone very recently because the first set, I didn't have enough body fat to disguise. You could see the rippling of the implant, so I had to switch them out.
Okay, let's talk first about her having breast augmentation before she had kids and at a young age, because I think there's some important things to discuss. The first thing that I think it's important to understand when I see patients in consultations is to let them know if they're going to be having kids anytime soon, like within a year or so, it's a good idea to not have the implants until they're done having children. However, if you're not going to be having kids for many, many years and it's something that you really want to do and you think that it's right for you after consulting with your physician, then it's certainly okay to go ahead and have the breast augmentation. One thing that's really important that I discuss with patients at their consult initially is I tell them this will not be your only operation. Implants will not last forever. You do not have to have them changed every 10 years. However, at some point in your life, there will be a second operation. And as you can see here, potentially even a third or a fourth, depending on what happens with your body and the implants. The second thing she commented is during her second operation, she said, I don't know where my breast went. Well, this is what happens when you have babies and the milk fills out the breast tissue and then shrinks down. The skin gets stretched, which is similar to what an implant does to the breast skin over time. And then it shrinks down and it actually starts to sag. We call that involutional ptosis, meaning the tissue starts to involute or go away. The skin has been stretched out with the milk, plus she had implants. And so the result of that is that the tissue starts to droop and sag. There are many women that have a breast augmentation and then have children and breastfeed and they're totally fine. Now, commonly we'll see the first baby, they're fine. Maybe even the second baby, they're fine. But man, as soon as they have a third, it pushes them over the edge and they start to drop like a bomb. The third thing she mentions when she had to have them done a third time is let's talk about rippling. Now, what is rippling? Here I have a silicone implant. Now, rippling is more common with saline implants than silicone. And what that is if you can see the edge of the implant here starts to fold, it creates little ripples on the edge, and that can show through in the skin if you're really super lean. So women that tend to ripple are women who have very thin skin and have a lot of involutional ptosis where the breast tissue is shrunken and gone away because they don't have a lot of soft tissue coverage. As I said, we see rippling more commonly in saline implants versus silicone implants, and we also see rippling more commonly in women who have implants above the muscle versus below the muscle. The reason for that is the pectoralis muscle is really thick and it covers the implant to camouflage the ripples. The important point to understand here is that women who are most likely to ripple are women who are very lean and don't have a lot of good soft tissue coverage versus women who have a lot of breast tissue and have thicker skin will tend to ripple the least.
I don't like surgery. My body does not react well to general anesthesia.
Okay.
And so when I go to have a surgery, it's a very big deal. And I have all my doctors have to meet with me before and have to tell me if they've seen any omens, if they saw any owls, crows, if anyone stepped on a spider, if there are any dead insects. Like, also make sure the music playlist, no music comes up that reminds you of like your ex-girlfriend or an ex-wife or anything that's going to make you upset because you're the surgeon. You need to be in a good headspace. If you have a fight with your wife, do not come in for surgery. I go through all of these protocols. My doctors have to go through this with me because I'm very afraid of dying under general anesthesia.
The first thing she said, she's scared of dying under anesthesia. This is a very, very common thing that we see with all patients. So here's the deal. You guys need to understand that as doctors, and we're doctors before we're surgeons, we're doing everything we can to risk stratify you into low risk, moderate risk, and high risk. I tell most patients, if you are otherwise a healthy person with normal labs, no other medical problems, you have a better chance of dying in the car on the way to the surgery center than dying under anesthesia. But the fact of the matter is, people just feel like being put to sleep puts them at high risk for dying. Now, if we risk stratify you before surgery and we realize that you're high risk, we're not going to do the procedure. Some surgeons would, but I would not. So we always take great precautions working with other doctors, talking about any other medical problems you might have, and discussing whether one of those medical problems would lend you to be high risk for surgery or just a moderate risk, and the likelihood is that you're not going to have any problem. But the fact of the matter is, it is extremely, extremely rare for someone who is being put to sleep by a board certified anesthesiologist who has been risk stratified as a healthy person to die under general anesthesia. Now, some of the other things that people worry about with the anesthesia is they get severely nauseous. That happens to my wife, and she'll only let 2 people put her to sleep, 2 of the anesthesiologists that I work with, 3 actually, because they have incredible protocols to prevent nausea. But that's another one that people actually really are scared of, is they tend to wake up nauseous and throw up. Now, there's one thing you can have your surgeon do, and I'll give you guys a little advice. You can have what's called a scopolamine patch placed behind your ear. So in patients that I identify who are high risk for having nausea problems after general anesthesia, I will prescribe that patch to them. They put it on the night before surgery and it starts to work so that when they show up for anesthesia, most of them do great after surgery and don't have any post-anesthesia nausea or vomiting issues. I think it is awesome that she is conscientious about how the surgeon is feeling. Did they have a fight or a disagreement at home? What are they listening to in the operating room? I don't know about the bugs and the spiders and all of that thing, but look, I love that. I love that she's assessing the mindset of the doctor when they come in, or the surgeon. But the fact of the matter is, I want to know, Megan, if the doctor showed up and said, yeah, I kind of got a fight with my wife last night, are you leaving and canceling and doing it another day? Or are you going to proceed with the surgery? As to music, oftentimes I'll ask my patients what they like to listen to in the OR, and we'll try to play that music when they enter the operating room before they're put to sleep. And then of course, once they go to sleep, we throw on the head banging music and we get down. What do you guys think that I like to listen to in the OR? Put it in the comments below and I'll let you know if you're right.
Any surgery is a risk to your life. I don't care what anyone says.
Right.
That's the truth. Going under general anesthesia is a risk to your life. It's a very traumatizing experience for me. I was like, I better wake up with the biggest boobs you can fit in my body. And that is what he said he did. And they're not even that big. They're a 32D, which is not that big. They just look big on my body because my body's tiny.
Right.
Again, we kind of covered this. General anesthesia, if you were otherwise healthy, is not that risky. However, it is a risk. As she mentioned, all surgeries have risk. There is not zero risk. There is a risk. And again, this is why we risk stratify people into low risk, moderate risk, and high risk. We would never operate on someone who's high risk. We will almost always operate on someone who's low risk. If they're moderate risk, we have to look at what are the problems they have and how risky are those medical problems relating to the surgery the patient is having. Oh, Megan, waking up with the biggest boobs possible. I'm not a big fan of that. I think that there are so many people that overdo it. Again, we see this in social media all the time with women with these like 3,000 cc saline implants, and there's so many potential complications with that. So number one, the thin skin over time from those big implants can literally cause the skin to bust open and the implants can extrude out. And while it seems really cool to have large breast or large breast implants, there will come a day when you are older where you will regret having them. I see this all the time in my practice where patients come in, they're in their late 40s, early 50s, they got implants when they were younger, they're way too big, they want to downsize, they want to get a lift. So there is such thing as going too big. And again, neck pain, back pain, thinning of the skin, stretching of the capsule, malposition of the implants, rippling because the skin is so thin from having large implants. And let's face it, gravity wins, and the bigger they are, the harder they fall.
I had my nose done when I was in my early 20s, and that's something I've literally been accused of having like 6, 7, 8 rhinoplasty surgeries, which is impossible. Your nose would get necrosis and fall off.
Me too, girl. I only had 1 rhinoplasty. I didn't have 6. I had 1 when I was 24, and I'm glad I did it. It was something that really bothered me, and I thought long and hard about it. And I was 24 years old, had a discussion with the surgeon, had a discussion with my mom and my parents, and we decided that it was the right thing for me, and I did it. Megan, again, impressing me, coming out with the big guns, necrosis. I guess she probably does watch a lot of social media. Maybe she's seen some of my videos, but necrosis is when the tissue dies. And she's absolutely right. When you have multiple rhinoplasties and you have to elevate the skin and do work, every time you do that, you're compromising blood supply to the skin, and you certainly could have necrosis and have death of the skin. And I truly believe that she's only had 1, and whoever did it did a fantastic job. She's got great proportions. It's very straight. Her tip looks good. It's a great rhinoplasty, and there's no reason to keep going in and doing it over and over, because guys, the enemy of good is better.
You've had your nose done, you've had your tits done, and what? Botox and filler?
That's it, right? Oh, there's one thing I had done that I'm gatekeeping because
Okay, I made a YouTube short about this part of the video, and so I want to kind of reveal here what I think she's had done. There were two things on my mind that I think that she could have had done. One would have been a labiaplasty downstairs, trimming the flaps. And that's actually a very common procedure that a lot of women do, and that can be a congenital issue. It doesn't necessarily occur from having kids. It absolutely can occur from having kids, but for a lot of women, it's just congenital where one side is uneven relative to the other. And listen, some women have what's called dyspareunia, which is painful sex because the tissue gets dragged in and causes a lot of pain. And so that's another reason why some women like to do that. Now, clearly, I'm never going to know if she's had that done or not. Now, here's what I think she may have had done, because she looked at Alex and she said, the procedure that I had, I don't think you've had it and I don't think you would need it. So what could that be? Well, if you look at these before and afters of Megan when she was younger compared to now, her eyebrows look so much more full to me now. Now, of course, there could be makeup in there making them look thicker, but I think because she said this was rare and not a lot of people know about it, I think she had a hair transplant to her eyebrows. So similar to a hair transplant where we take hair generally from the back of the scalp where there's a lot of robust hair follicles, and we transplant it to different areas in the forehead where we poke small holes into the area of hair recession, that the follicles will grow. You can do the same thing for the eyebrow. They can poke little holes in between all of the current hairs in your eyebrow, and we transfer what's called a follicular unit or a single follicle into the eyebrow, and it will take and it will grow, and you will have thick, bushy eyebrows, hopefully not too thick and too bushy. But for sure, this is a procedure that can be done. I don't do it. Not a lot of people do it. There are specialists that do it, but that's how you do the transplant, and it absolutely works. Let me know if you guys agree in the comments below. Thanks for joining. Catch you next time.